I'm Andrew Old, the Chief Clinical Officer for the Northern Region Health Coordination Centre, and I'm joined today by Dr. Anthony Jordan, our Associate Chief Clinical Officer, and Dr. Christine McIntosh, the Clinical Lead for our Home Isolation and Primary Care Response. Shortly, I will get Anthony to update you on the broader regional clinical response to Omicron and the situation we're seeing across our hospitals. Following Anthony, Christine will outline how our home isolation and primary care colleagues are managing. But first, I want to give you an update on today's numbers. We'll provide the national numbers and hospitalisations first, but our focus today is very much on the regional response here in Auckland. So across the country today, we are reporting 22,535 new cases of Covid-19. 13,252 of those are here in Auckland. There are 562 people in hospital, with 11 in ICU, and for Auckland those numbers are 382 inpatients, 7 in ICU. Further details on the national case numbers will be provided in the Ministry of Health's 1 p.m. written update. So nationally, cases continue to rise rapidly as Omicron spreads through our community, but this is not unexpected. Our local modelling suggests that for Auckland, we are now close to peak daily cases, but the number we're focusing on now is the people in hospital, which generally lags our cases by 7 to 10 days. Hospitalisations in Auckland remain low as a percentage of the total number of positive cases, with just under 0.5% of our now over 100,000 active cases currently in hospital. Over the course of the Omicron outbreak, less than 2% of cases have had treatment in one of our hospitals. These numbers highlight the need to ensure that those in our community who do get Covid-19 get access to the right care at the right time and in the right place. Shortly, Anthony will talk more about the regional response and what he's been seeing in our hospitals, but I do want to remind and reassure the community that Omicron is a mild illness for most people. We are very fortunate to be facing this surge with a highly vaccinated population, and because of this, most people are managing the virus and recovering well at home without needing any medical care. Although most people will experience a mild illness, the sheer number of cases means we still have many people who do require care. While we have a range of care options in place, it is very important that we prioritise services for those who need them most. In terms of testing, there's been a huge demand in recent days, and I want to remind you all that you only need to get tested if you have symptoms or you're a household contact. Our 17 community testing centres are very, very busy. Yesterday we distributed almost 160,000 rapid antigen tests through those 17 sites alone. People who need a test can now order online for click and collect from a dedicated collection point, so I encourage people to take that option to avoid the potential for long waits at our testing centres. We now have 10 new RAT collection centres across the Auckland region, in addition to the 17 CTCs. At this point, I also just want to thank people for their patience with our staff, who really are doing their best to get through everyone as quickly as possible. If you do undertake a RAT test and it is positive, it's very important that you register your test at mycovidrecord.nz. This gets you into the system, allows us to assess your risk and work out if you might need additional support or care while you isolate. I'll now hand over to Dr. Jordan to outline in more detail the care model if you do need some additional help.
Thank you, Andrew. Kia ora koutou. As Andrew said, the most important thing we want to reinforce at the moment is that for the vast majority of us, COVID as an Omicron strain is a much milder illness than things that we've experienced in the past. This is particularly true for those of us that have been vaccinated, including being boosted. Most of us will be able to recover at home, and with simple strategies like hydration, using paracetamol for muscle aches, that should keep most of our symptoms under control. If you do start to feel worse, we have systems in place to be able to respond to the level of care that you need. We'd ask you to reach out and contact us first if you've got mild or moderate symptoms, in particular through Healthline or through your GP if you have one. As we see increasing demand on our hospitals, both because we have more COVID-19 patients, but also as our staff, just like the rest of us, fall ill, have to isolate at home, that's putting additional pressures on us to be able to meet the demands that we were under prior to the outbreak. It still means that we're able to deliver care, but it's really important that we stress getting the right care from the right place and saving our emergency department for those urgent and critical needs. We would, however, like to apologise for anyone who may be experiencing any disruptions in their planned care because of us having to postpone some of that activity. The District Health Boards here in Tamaki Makaurau have plans in place to address this and are working with their clinical teams to ensure our hospitals remain safe, staffed and delivering the urgent care that they need to. So we will be here to provide that care. We have also been doing what we can to relieve some of those pressures by making sure there are a broad range of care options available to those in the community for COVID and other conditions as well. This week we have established 4 urgent care hubs, 2 in South Auckland, 1 out west and 1 on the North Shore. These hubs are designed primarily to take care of patients who have COVID-19, but they may have other medical issues. So things like minor burns, injuries, UTI or back pain are some of the conditions they would be able to help with. These clinics are part of our overall whānau HQ program in Auckland, which provides a range of care options for those recovering with COVID in the community. I particularly want to emphasise that care for our COVID patients is free across the country, including GP appointments and urgent care clinics. A really vital part of our health response is our primary care colleagues, the many hundreds of our GPs and pharmacies who are supporting the response to Omicron. I particularly want to acknowledge them and the other people in the sector who are busy doing their day-to-day work and supporting the COVID-19 response as well. They are busier than ever and are also starting to be affected by staff shortages as well. For this reason, I ask people who are experiencing cold or flu-like symptoms to again, as I earlier mentioned, manage these symptoms at home as you normally would so that our GPs can be there to support those people who may be more unwell. As well as hundreds of GPs supporting our COVID patients across Auckland, we have our 200 pharmacies in Auckland who are supporting by providing free advice, free prescription and non-medical deliveries where needed. So while we see some strain across the system with numbers rising, it is a collaborative, coordinated effort which is ensuring that we're still able to provide the care to those who most need it. I will hand over to Dr. Christine McIntosh now for an update on her primary care situation from her colleagues.
Thanks, Anthony. Tēnā koutou katoa. As Anthony mentioned, although most people will be able to recover at home with the support of friends and family, we do have additional support in place for those who actually need it. This includes healthcare as well as the welfare support for things like food or if you're having some financial difficulties. For people who do get particularly sick or are at higher risk, so for example if they have many underlying health conditions, then their GP or nurse will be able to provide support. All healthcare, as Anthony said, will be free for COVID-related conditions. In addition to the main whānau HQ COVID care in the community hub here in Auckland, we have also established specialist Māori and Pasifika coordination hubs. These help to provide care for whānau in our Māori and Pasifika communities. These services are aimed at those who need extra help. Like if they're having difficulty getting food, or they're particularly concerned about a whānau member who might be at higher risk. As part of this, we're working very closely alongside Māori and Pasifika health providers who are helping to care for families and to connect them with the right support. Alongside this, our teams are working very closely with our general practices in the Tamaki Makaurau area. Our new urgent care hubs are where families and people with other conditions who currently have COVID can go and get some additional help for accidents and urgent problems that Anthony talked about. But primary care and urgent care are feeling the pressure across the system. So this is both because of increasing COVID numbers, but especially because their own practices are being impacted by staff shortages. They are doing a phenomenal job. It is hard work out there. They are the front line to the response. But we do want people to access the support they need when they need it. So if they feel that them or their family members are getting symptoms that are really quite concerning, they feel like they're getting worse, it's really important that they do reach out. They can reach out to their GP, their nurse, or to Healthline, and they can seek further advice at that point. Obviously, it's really important to stress that if your symptoms are becoming severe, examples of this could be real difficulties with your breathing, you're feeling really acutely short of breath, you're having difficulty moving around the house, you're getting chest pains, you're feeling dizziness or confusion, or your family member is, it's really important that you call for help and you call 111 for the ambulance. As we said, ambulances when you need them for COVID are free. We also want to encourage communities to look out for each other. We've got a large number of COVID people suffering COVID in the community at the moment, and it's really important that we're all looking after each other. So if you know somebody who has COVID and you could potentially help them out by dropping off some food, a pre-cooked meal, something like that to their front doorstep for them, or giving them a daily call just to check that they're okay, then this is really appreciated, and it's part of being kind to everyone in our community at this time. It's particularly important for elderly people or those people who might be living alone. I know that some people may be feeling quite anxious as these numbers are quite high, but I do want to reassure you that for the majority of people, Omicron is a more mild illness that they're coping well with at home. They might feel a little bit unwell with cold and flu symptoms, but generally they're actually able to manage within their home. But I just want to stress that if you do need the care, it's really important that you do reach out for it. You don't wait till things are really bad, and that you seek help from your GP or call an ambulance if you need it.
Thank you, Christine. Before we go to questions, I just want to take this opportunity to say a huge thank you to everyone working in the COVID response across the country, whether that's in the community or in our hospitals, with a particular shout out to our teams here in Auckland. All parts of the system are incredibly busy right now, and the dedication and professionalism that people are showing across the response is inspiring. Our teams are doing an amazing job caring for patients, and amongst all the numbers, it's important to acknowledge the additional effort being made by our people, and in particular their ongoing flexibility and goodwill as we provide care for the community. Thank you, and so at that point we're happy to take questions. Thanks for the question. So I think the important thing with testing as we shift to using rapid antigen tests is that we know that unlike when we were testing with PCR, we don't have as good a picture now of the number of people who are taking tests. We know that not everybody is entering their results into My COVID Record. And just to pick up on a point before, really important reminder that if you do take a rapid antigen test and it's positive, please enter your result at My COVID Record. It just means that you are in the system and we can offer you support. But in terms of the stockpiling question, at the moment we have a lot of supply in the country. We've got 9.3 million tests in stock, 8.8 million dispatched in the last 7 days, and a further almost 100 million coming in. So I do encourage people, if you don't need to get tested, then don't get tested. But right at the moment, we're confident that we have enough supply for people who need it. I would say that look, we're all in this together. I think the As both colleagues here have said, this is a whole system response. We need everybody to be playing their part. That's people playing their part, looking after themselves at home if they're sick, our primary care colleagues and our hospital colleagues, and that includes, as I say, the community doing the right thing. So I would encourage you, if tests are being provided free at the moment for those who need it. They are provided through retail outlets across the country for people who are not symptomatic and not household contacts but want that certainty. So really just encourage people to not take advantage of the system.
What should people do if they have COVID-like symptoms but keep testing negative with the rats?
Yeah, another good question. So we know that rats as a test are not as sensitive as PCR. So I guess my advice is it depends on how important it is that you have a result. So for our critical workforces, then we really encourage people to, if they have ongoing symptoms and they're getting negative rats, particularly after 2 negative rats, our advice would be to seek a PCR test for confirmation. Although we have switched most of our testing response away from rapid antigen tests to away from PCR tests to rapid antigen tests, we still have good capacity for PCR, and it is there as a confirmatory test for people who need it.
Is there still a backlog with the PCR tests?
So obviously that's been a significant interest this week. There is still a backlog, but we expect to have that cleared over the weekend.
In regards to hospitals, how many staff are offset currently, and will those
I can't give you the exact figures at the moment. Obviously, here in Auckland, we're seeing a large number of people stood down. That's just not because they've got COVID, but they also may be requiring to stay home because they're a household contact, or care for children, for example, who have COVID. So we don't have the specific breakdown at the moment.
Is it in the hundreds that are off either sick or isolating?
Yes.
Great question for you, Andrew. We've spoken about being close to the peak. Today's the first day in a while we're actually seeing cases of over slightly, but what would you say to people who might be feeling optimistic about that? How many cases are we expecting at this point to get to that peak?
So, I can talk for Auckland. So we are cautiously optimistic that at our sort of case numbers around about that sort of 13,000, 14,000 level, that might represent the peak for us in Auckland. To say, we've only had a few days at that level now, and we are distributing a lot of tests, but based on our modelling and what we've seen from overseas, we expect that we might be about to turn the corner. So I would say that we are cautiously optimistic about that.
And the peak for hospitalisations obviously come after the recent cases. So what's your sort of understanding of when you might get to the first hospitalisations? Are you concerned that this will go up quite a bit?
So we certainly are expecting hospitalisations to go up from where they are now. At the moment we don't have a particular figure that we think they will peak out at, but if we are genuinely turning the corner with cases, which we hope, we would expect that hopefully hospital numbers might peak in the next week before starting to come down as well.
And you probably know you talked about it for Auckland, but do you have the latest update on the vaccination status of those people who have been in hospital at the moment?
We'll be able to provide that with the 1 p.m. update written report from the Ministry of Health.
Sticking with hospitalisation, so I don't know if this is Dr. Jordan or Dr. Albright, either or. Hospitalisations have already exceeded the best case scenario, and Dr. Boothwood yesterday was talking about hospitalisations peaking in the next 3 to 4 weeks. So have you hit your worst case scenario yet? Are you on that track for the worst case scenario?
No, I don't think we are on a worst case scenario. So one of the things that's really tricky, and we've seen this overseas, is for hospitalisation, seeing who's coming into hospital who has COVID versus those people who come into hospital because of COVID. So when we're talking about the capacity of deterioration of patients for COVID, that's quite different from people who have just tested positive but are coming in to deliver their baby, come in for back pain unrelated to COVID. So at the moment, that still puts pressure on the bed pool and obviously the staffing requirements to care for them, but it hasn't really exceeded our expectations at this stage for COVID-related sickness, for example.
Around 550 people in Auckland Hospital, around 500 people in Auckland hospitals at the moment. But what's your maximum capacity for COVID patients, and when does it start being a potential risk to patient safety?
Yeah, so what we have in place at all of our hospitals across the Auckland Metro region is for stage plans to grow our COVID capacity in our wards. So whereas in Delta we had maybe 1 or 2 wards dealing with those patients, we're now sort of extending those wards out to 3 and 4. So that's extending those conditions that were provided in that 1 ward previously to more wards. And we'll see that happening a lot more because people will need to obviously come to hospital for other reasons, so we'll need to put those COVID precautions across a greater number of wards moving forward.
I have a GP question.
Sorry, Liz? No.
On the subject of reporting vaccines, what's the easiest way to report child support this? We've had reports that people have been applying to hours like trying to do so, obviously children don't apply to.
Yeah, we're working very hard to clear that backlog, get those wait times down. I think actually the 0800 number for children is probably the most convenient way to get that set up, just because of the difficulties with not being able to have a My COVID record when you're young.
What would you say to parents who are waiting hours and like that report?
Yeah, just obviously call back later. You know, if you're waiting a long time, just call back later. There are times where we have peak numbers of calls. Obviously, we don't want you to have to wake up at 2 a.m. and call us, so we are shifting our staff around to meet those demands at all of our call centres.
Just a GP question. I spoke to a GP out in South Auckland today who said he's really concerned about the workload and that it's having an effect on sort of nurses, doctors and admin staff like receptionists. What support is being put in place for primary care clinics?
Thank you. Yeah, that's a really good question, and no doubt there are, without a doubt, there are GP clinics who are under a lot of stress at the moment with the number of numbers coming through, but also experiencing staff sickness themselves. We are working really hard to support those practices, both the PHOs, the primary healthcare organisations and the whānau HQ hub to support those practices. And part of that is actually supporting those practices to be able to prioritise and really encourage them to really look and see who really needs actually to have that daily call and things like that, and who actually is coping really well at home, just managing themselves. So I think that's really important, but what I would ask those practices to do is to reach out to their primary healthcare organisation and explain the concerns that they have, and we collaboratively will support them around that, and we have some tools in place and things to help with that side of things. Yep.
He said that as much as sort of there was obviously physical concern with people catching COVID, there was also a lot of distress they were dealing with from patients, particularly when their children were getting sick. You know, even though we know it's mild, it's still COVID, and that obviously is a lot of fear in people.
Yeah.
How will that be managed?
Yeah, I think what you've really talked about there is really, really important, is that actually we've spent 2 years feeling quite fearful about COVID, and actually we have a really well vaccinated population, and we know that people who are older are much more likely to be more vulnerable, but having said that, we're really well vaccinated now. Children actually generally come through the COVID illness really, really well in the main, and so it's really important that we actually as a community expect that actually this is likely to be an illness that most people will manage really well in their own home, but clearly any of those severe symptoms, they really must reach out and get help.
And just finally, the GP I was speaking to, Dr. Aputale, said that at his clinic it was already not business as usual. They were having to stop things because of the workload. Is that a worry that people are not going to get, things like potentially cervical smears because they can't come into places?
It's really important at these times when the system is really dealing with an unprecedented number of people with COVID that we actually prioritise the activities that we're doing. Now, all of these things are a priority in each their own way, but at the moment we really have to support that practices are able to make their own decisions really about what is the priority for them at this time, and depending on what's happening in their community and responding to the need in their community. So I really do support them, implementing what they need to around that surge plan.
People at the Westgate practicing centre reported that they were being turned away as supplies ran out. Are you able to say whether there are sufficient racks in Auckland?
Thanks. Yes, and I suppose I'd start by apologising to people who waited for rats and weren't able to collect them. We certainly do have enough rats in the system in Auckland, but the challenge that we have at the moment is just the sheer demand and getting them to the right places. It's very hard for the teams to know exactly how many are going to be needed in any particular place at any particular point in time, and at the moment the numbers that we're giving out are going up hugely, so basing stock levels on what we delivered yesterday in many cases is not sufficient. So as I said, we distributed something like 160,000 tests across the network in Auckland yesterday, just the CTCs, and we expect to increase on that today. So yes, apologies to people who had that situation. The teams are really doing their best to try and make sure that we have supply in the right places, but just to reassure people that there certainly is enough in Auckland at the moment.
And what's being done to ensure that people need them?
So at the moment, the criteria for people who need to get them are quite clear. So people need to have symptoms or be a household contact. So if you're going to one of our community testing centres, then the teams there are screening people to see whether, making sure that people who are collecting them are in fact the people that we want to be collecting them. And now with the online ordering form, there's a system there where you go through and it helps guide you to see whether actually you need to be collecting them or not. We are monitoring as best we can who we give test kits to. As I say, that's with the volumes we're giving out, that's really hard, so we don't have a really good idea of all the tests that are being given out, which parts of the community they're getting to. So we are working closely, particularly with our community providers, our Māori and Pacific community providers in particular, to make sure that they have good access to tests for their populations as well.
How are you ensuring that rats are getting to, incredibly vulnerable communities like the homeless community?
Yeah, great question. So I think a little bit building on my previous answer, we are working directly with those collectives, so with the City Mission as an example, with our Māori and Pacific providers, and we're really fortunate that we've been planning for this for about 2 years, not specifically for rats distribution, but for COVID generally. So we've got really good relationships across the system with those providers, and so we're working really closely with a lot of NGO and community partners to make sure that they have good access to rats for the particular populations that they serve.